Well, it's really was initiated more by patients' desires, their questions about, well, they're having these symptoms that seem to be, we know as professionals that it's related to dry eyes. They'll talk about how they get this, feeling during the day or in the evening. Usually it's first, it starts early in the morning and then also later at night where the symptoms are the greatest. But they'll say anything from they feel dry or they feel irritated, their eyes get red, they feel some burning or they feel some tearing but their eyes aren't really shedding tears. They just feel teary. And then another big one was that sometimes during the day, especially if they're at a computer, their vision would get hazy and then clear up at times, so intermittent blur. So that there was so many of these people that were coming in, especially with the now with the use of extensive use of computers by everybody from young to old. And so we're getting a very wide range of age groups that are coming in with these type of complaints. So for years, we've been looking into how to treat this. And a lot of times we started out with drops. There's also medicated drops. Um, and that works to a certain extent. And it also there's side effects of the medicated drops. And we tried to start looking at more natural approaches. One of the approaches was using punctal occlusion, some plugs that help the patient build up their own natural tears in the eyes. And that actually took off very nicely. And people were, symptoms went down. So we knew we were hitting the right area um, by treating them with something like that. But there was something more than that. And we saw in all the research that a lot of this is evaporative. And people at computers or who drive a lot and don't blink a lot also are not stimulating the certain glands in their lids and causes those glands to become like plugged up. And the integrity of the tear film is just bad. And this, again, ranges from age groups from young to old. And we found that by expressing these glands, there's different ways to do it. And the most laborious way was using hot compresses and lid scrubs. And we saw that this really did work, or manually expressing those glands. But when these other instruments came out, especially like the iLux, and they're on their second generation of iLux, and saw demonstrations of this, we really saw that this is what we really need. And then from there, we actually had it performed on the patients in the office, even the workers in the office. I'm one of them. And that's what really made us embrace it, because I saw for myself the results that you get from this.
In their everyday life, sometimes they're forgetting to use their drops, forgetting to use treatment, and they come in, they want, somewhat of a quicker fix. And when we're able to actually do something for them in office to reboot their oil gland production, they're really, they want something that we can do as doctors to help this as well, so that they don't have to remember in their everyday routine to do the lid scrubs, to do the warm compresses. A lot of them are worried that they're not doing it the right way. So, a procedure that we can do in office to help with that, they really found helpful.